A 35-year-old patient presents with progressive facial weakness and hearing loss. MRI shows a mass along the facial nerve pathway, which location is the most likely site of origin for facial nerve schwannoma. Options are: first is labyrinthine segment, second one is geniculate ganglion, third one is mustard segment, and fourth one is tympanic segment. Answer of this question is geniculate ganglion. This is axial T1 weighted MRI showing contrast enhanced lesion in the internal auditory meatus, which extending along the greater superficial pituitary nerve. This mass suggestive of facial schwannoma, which extending into the area of greater superficial pituitary nerve. This is the MRI of same patient showing facial schwannoma arising from the geniculate ganglia and extending through the petrosal foramen into the middle fossa. This is axial CT of temporal bone at the level of internal auditory meatus, and this showing homogeneous mass at the geniculate ganglia on the left side with round smooth bony expansion of this area by the this lesion. Why geniculate ganglia is the most common site? Because it's having high presence of nerve fiber with abundant amount of Schwann cells in this area. Facial nerve schwannoma can arise from anywhere along the course of facial nerve from CPA angle to the ramification within the parotid. The presenting symptoms will vary according to the segment involved. The relative frequency of occurrence at each site. Most common site is geniculate ganglia about 68%, labyrinthine segment is second most common site about 52%, tympanic segment is 43%, and mustard segment is rarely affected by the facial schwannoma. Most common presentation is the progressive weakness or spasm of the facial nerve, or sometimes it's seen as sudden onset or recurrent facial weakness, and it is rarely seen as decreased hearing. So most common presenting is the progressive weakness of facial nerve.